Thank you, Mr. Chairman, and good morning, colleagues. Today, on the last day of Care Workers Recognition Month, we're going to discuss 19 proposals to improve Medicaid home and community-based services and ensure funding for Medicaid is well spent. Medicaid is the largest payer of long-term support services in our country, providing health coverage to more than, as the chairman said, more than 77 million low-income adults, children, parents, and individuals with disabilities nationwide. The American Rescue Plan Act, which Democrats passed in March 2021 without a single Republican vote, increased funding for Medicaid HCBS by over $37 billion. Every state, every single state, took advantage of this funding to retain, expand, and train direct care workers who are the backbone of our long-term care workforce. We have to continue to build on that progress. President Biden recently said that, quote, if we want the best economy in the world, we have to have the best caregiving economy in the world. Several of the proposals before us today, I think, get us closer to that goal. The Money Follows the Person Permanency Act of 2024, introduced by Representatives Dingell and Balderson, makes permanent the Money Follows the Person demonstration. It's a critical program to provide enhanced federal funds to states to help seniors and people with disabilities move from institutions to the community. The Stop Unfair Medicaid Recoveries Act, introduced by Representative Schakowsky, and the Protecting Married Seniors from Impoverishment Act of 2024, introduced by Reps. Dingell and James, and the outdated systems that keep Medicaid beneficiaries who need long-term care and their families in poverty. Representative Schakowsky's legislation stops states from going after families' homes for repayment of Medicaid long-term services. Again, Reps. Dingell and James' legislation protects spouses from having to deplete their financial resources to qualify for Medicaid coverage for long-term care. Some of the bills being considered today are partisan and would roll back recent progress to improve the quality of long-term care. For example, the Biden administration recently finalized a solution to the lack of staff providing care in nursing homes. Hire more staff. The new rule requires a registered nurse to be on site 24 hours a day, 7 days a week, instead of the current minimum of 8 straight hours a day. The rule also requires nursing homes to have enough nurses and nursing assistants to be able to give each resident at least 3.5 hours of care per day. I don't know about all of you, but I think if I were in a nursing home, I would want those standards. These requirements phase in for most facilities over 3 years, but give rural facilities 5 years to come into compliance. It also provides $75 million in grants to train nurse aides. The Protecting America's Senior Access to Care Act by Representative Fishback and Pence prohibits this policy, and it stops any similar rule from ever going into effect. The Biden administration also recently required at least 80% of home and community-based payments to go directly to care worker pay. This will help raise the pay for the home health workers our loved ones rely on. H.R. 8114 by Rep. Kamek prohibits this policy and stops any similar rule from ever going into effect. I support the administration's recent rulemaking to improve nursing home quality and raise the wages of care workers and oppose both of the aforementioned bills. Today's hearing is about the hardest questions a family can face. How do we take care of a family member at home? If that's not possible, can we trust a nursing home? How are we going to afford this care? I hope we can work together to find solutions to make the answers to those questions a little easier. And with that, Mr. Chairman, I yield back.